And then we can wait a couple more minutes and then we can get started. Okay, I'm gonna just hop in it. We're here, we're ready, we're on time, we're early. I love that. That's definitely how we are. But welcome our community members. This is our info session for this fall semester. We're definitely super excited. So just to keep in mind for you to maybe have something on the top of your head, or something that really stands out to you. These are the programs that we're going to be talking about. We're going to talk a little bit about our organization. Dr. Livingston, if you want to hop in and talk about that, I think that would be great. So I can get a break. I hate talking all the time. Then we're going to go through introductions. We'd love to hear about you. We'll talk about our high school program, internship and work opportunities with us, and then our pre-med advising specifically geared towards people looking to apply next cycle or in the upcoming cycles. So next spring 2025, and then even that next year with our pre-med advising. So Dr. Livesey, if you want to quickly kick it off.
Yeah. So, hey, y'all, I'm Dr. Cherie Livingston. I am a founding board member of Patients Are Waiting. And Patients Are Waiting is a nonprofit organization, a 10-year-old nonprofit organization born here in Lancaster County. And our mission is to eliminate health disparities by increasing diversity in medicine. So we want to make Black and brown everything, right? Doctors, nurses, doulas, midwives, hospital administrators, X-ray techs, everything. Our goal is to diversify medicine, and we have 3 areas of focus. The first area is to increase the number of minority clinicians, just like y'all. Cast a wide net and bring y'all into the fold. The second area of focus is to make that pipeline less leaky. For those who say, I want to become a nurse or a doctor or an X-ray tech, we don't want to lose you in that 13-year process of becoming one. And then the third area of focus is to support minority clinicians in practice. So for example, doctors like myself, I'm an OBGYN physician here in Lancaster. We need to support each other so that we can grow in our respective specialties. So we're happy to have y'all here, and that is everything PRW.
Oh, I had no idea I had this. So I guess it's been that kind of day, y'all. So Dr. Livingston pointed on a little bit about all of those details, but in terms of breaking down even on a more granular level, as we're talking about programs today, I think that makes a lot of sense. So in terms of increasing the pipeline of minority clinicians, we work to collaborate with different STEM camps locally in Lancaster, where we can bring students to the Black Doctor Factory. They can see our mural there. If you haven't been to our office, you will love it. But it's really just exposing young people, young minds to Black clinicians and scientists. Then our Pipeline Dreams High School program. I see a couple alums on the phone call or on the Zoom. I see y'all. So this is a 12-week career exploration program for high school students. So this is a picture right here of Kayla at one of our hands-on days. So it's a hybrid program online with a couple in-person touch points. In terms of making the pipeline of minority clinicians less leaky, we have the annual Diversity in Medicine Conference, which we're definitely going to talk about on the call today. We all would like to extend a very heartfelt invitation to each and every one of you. We're going to talk about MCAT prep. We're not going to talk about UPenn paid summer research today, but this is something that we do because the cohort just finished. But every like late fall, winter, that application opens up to collaborate. We collaborate with an OBGYN in Philly to offer this opportunity for research. And then we also are able to sponsor different students to attend conferences around the country. And then lastly, in terms of supporting minority clinicians in practice, the What the Health Book Club, a health equity book club, we meet that last Wednesday of every single month and discuss a book. You don't have to read the book, but it's cool just to have some grounding. We're talking about different racial health equity topics. Mental Health Initiative. This is a great way to connect people, especially Black and Brown people seeking mental health services to Black and Brown providers that look like them. Our DDI initiative, that's Dr. Livingston's baby. We work to provide subsidized doula care to birthing people of color in Lancaster County. And then every Sunday, the first Sunday of the month, we have our PRW community call where everybody just comes on the Zoom, eating dinner, eating lunch, eating dinner. It's in the evening at 7, doing whatever, and just really checking in, connecting with people, seeing who's applying, seeing if somebody needs an internship or a shadowing opportunity. That's a really cool way to engage all of the different groups of people that engage with our organization. Okay, so y'all can see I can chat and y'all can see I can talk. We are definitely always wanting people to participate. We want everyone to be engaged and have a really welcoming environment for us. And we love curating that online as well. So popcorn style, please just come off of mute or raise your hand if you know how to do that on Zoom. It's under the reactions. Jordan, you're the first one on here. I'm going to popcorn to you, but first I'm going to model exactly what I would love to hear from y'all. So my name, I'm Carissa Augustine. I'm interested in public health and research, and I'm having a great time with Patients Are Waiting right now. I'm the program director, or excuse me, I'm the pipeline program director here. I'm located in Philly, and I'm coming to Lancaster to be in the office a couple days a week. And I got connected with PRW right after college, so it's been an amazing time staying connected. Okay, how did I do? Y'all can show me some love in the chat.
Did
If you feel so
good.
inclined. But Jordan, you want to kick us off?
Yeah, you did good, but you definitely surprised me by having me go first here.
You got
My
this,
name
Jordan.
my name is Jordan. I'm currently a senior in college, which is the first time I'm saying that. I've been trying to graduate early and graduate in 2 years instead of 4, and I've been working to do classes during the summer, and I've just been notified that I'm on my right track. So I'm currently a senior in college at St. John's University. I am studying health and human services, and once I leave, I would like to apply to a couple schools so I can become an ultrasound technician and cardiovascular. I'm located in Philly, and I got connected with Patients Are Waiting through their 12-week high school program, actually.
Wow, Jordan, that is so exciting when I heard you say ultrasound tech, because as an OBGYN doctor, I know how valuable y'all are to medicine. So kudos to you, and come to our diversity in medicine conference, because we have ultrasound there, and we're scanning each other's gallbladders and hearts and doing some really cool things.
I will, because I'm definitely still, I think I want to do cardio, but I'm definitely still on the fence of exactly which concentration I want to go down. So
That's fun. I love it. Popcorn it to somebody, girl.
let me see who's here. Shay. I don't know.
Maybe,
Is Shay here?
yeah, maybe. I
Hello.
know. Okay, there you go.
Yes. Hello. My name is Shay Saunders Armand. I go to the French American School of New York School. I am currently going to be a senior, and I'm here to support my Aunt Charisse.
That's awesome.
Thank you.
Cool, Shay, you got to popcorn it to somebody.
Sorry. Also, I am looking to study music and visual art therapy, and I'm thinking of studying medicine as well.
Great. Thank you so
Thank
much
you.
for sharing.
No problem.
Okay. Yeah. Who would you like to go next? Okay. I'm gonna pick Nye.
Hi, my name's Denasia, but you can call me Nay. I am studying public health on the biology track, and I am a junior. I go to Franklin and Marshall College, and I'm interested in studying pediatric oncology, and I am located in Maryland.
Ooh, pediatric oncology. That's awesome. Any particular reason? That's a very specific focus. I like it.
It's not really a specific reason. I knew ever since I was a little girl that I wanted to work in medicine. But as I got older, I just felt harder for the kids. So I wanted to help them.
I love it. Popcorn it to somebody.
Nicholas.
Hi, good evening, everyone. I'm Nicholas Paul. I'm going to be a sophomore at Adelphi University. I'm a biology major with a minor in finance. What else does it say? It said, where are you located? I'm from Long Island, and I would like to go to med school and become an orthopedic surgeon.
Amazing. I'm excited to get you connected with our network, Nicholas. Let's get one more.
Thank you. I'll pick Fatma Mohammed.
Hello, it's for my daughter. She will talk. Minna.
Hi, I'm Mena. I just joined on my mom's phone because she had the link.
Yeah.
I'm gonna be a freshman at Penn State in Harrisburg, and I'm studying biobehavioral health, and I'm looking for like something that I can get some experience, so like an internship or something. But, yeah, excited.
Oh, that is exciting. I was born and raised in Harrisburg, so when you said that, it piqued my interest. So, get to know patients are waiting because we are so well connected both locally and nationally.
Thank you.
Yes. And especially with Hershey Medical School at Penn State.
Yes.
Shameless plug. They're one of our partners that we love to work with. So welcome everyone. Thank you for introducing yourself. I know a lot of times Zooms, it's just like a presentation and it's really boring. But if I'm running it, it's always going to be a sensational time, one. But also two, feel like comfortable just coming off of mute, talking, engaging with each other, because I think something we do really well as a school agnostic organization, meaning we don't necessarily affiliate with one school or one place. We have students all across the country, is that we love using technology as a way to connect and reach students where they're at. Like just hearing where y'all are, New York, Long Island, we have Maryland, I'm in Philly, our Livingston's in Lancaster, F&M, Lancaster. So it's really great to be able to connect with each other, but it only works if we're engaging, right? It only works if we're participating. It only works if we're paying attention. So that's a quick little level setting. I couldn't resist. But I wanted to jump right into our flagship event that is coming up September 25th to the 29th, our annual Diversity in Medicine Conference. Dr. Livingston, do you want to talk a little bit about this before I reveal some cool opportunities and micro internships we have for students both locally and remote?
Absolutely. So I want y'all to, just dive right into this this part of the conversation, because this is our flagship event. This is the event that we've been doing for 8 years now. So we're a 10-year-old organization. We've been doing this for 8 years. And why do we do this? This culminates everything about the being of patients are waiting, what we are emphasizing, and that is strengthening your pathway into medicine. And so it's a 5-day event. We started off with 1 day, And because of the popularity of the conference and the needs that we saw, we realized that one day wasn't enough. Last year we had 150 registrants. We're anticipating that and then some this year. But Wednesday we have a book club event. Thursday we have an open house, so y'all can come down to the Black Doctor Factory that I just left an hour ago and see our home. I call it the 3 H's. It's our hub, our home, and our headquarters. And so y'all can come down there and really see what we're all about. Friday, we have a blood drive. I know I was like way deep into my medical career when I learned that a Black physician invented blood banking, a way to store blood so that we could save lives. And we just don't hear a lot about that. Dr. Charles Drew. And so he's painted on one of our walls in the Black Doctor Factory. And so we pay homage to him and other Black and brown doctors by having a service event every year on the Friday before the Diversity in Medicine Conference. And we have a flow donation drive. So we also support menstrual equity, right? 1 in 4 girls does not have enough sanitary or menstrual hygiene items to menstruate safely. And so we want to eliminate health disparities. We want to address health inequities. And so we do it all throughout. And then Saturday, of course, is the amazing conference where we have didactics in the morning, we have a keynote speaker in the morning, and then the afternoon is just studded with like hands-on stuff. It is crazy, right? Like last year we had a Da Vinci robot, so students were sitting at the robot pretending to do like robotic hysterectomies, and it was just really cool. You can pretend you're doing laparoscopic surgery, so it's really hands-on and cool. And then we top it off on Sunday with golfing, because we want people of color to be in spaces that we usually don't see them. So we are a very intentional organization. We are not afraid to use words like systemic and structural racism. We're not afraid to use things like Black and brown and diversity and inclusion and belonging. You will hear Dr. Hamblin, Carissa, and I talk about that very freely, because in order to provoke change, we have to stare this very clearly in the face.
Yes, thank you so much. So you just really got me excited. Our theme is The Future Is Now, because you all, people on this call, you all are exactly who will be empowering the next change in medicine and addressing a lot of the reasons why we have this organization. So that all being said, I dropped the link in the chat. You can scan this with your phone. You can click around and see some pictures and see what it looks like. But obviously, we also want to, this is a big undertaking, right? We have 5 days of events, and we love to engage students to be on board with our planning and also be able to receive obviously all of the gems, all of the networking, all of those things that come with the event. So we have, we're looking currently, our first kind of undergrad internship that I wanted to speak on was joining this Diversity in Medicine Conference team, DIM team. What it looks like is we want to identify a coordinator, maybe somebody who is recently graduated or going to be graduated or has kind of a smooth, slower, maybe fall semester, who's maybe doing a post-bac or wanting to do research in their gap year, really just to support all of the admin, the planning, a lot of that connections, and lead our like volunteer team. We have a staff of like 10 dedicated volunteers that always come and support day of. But we also thought it would be a great opportunity to as well engage also in like a micro internship in a remote way for undergrads as well. And then also coming for the weekend, or excuse me, for the week to support us in person to put on this event. Really what it looks like is helping logistics, bookings, social media postings, emails, connecting with attendees, and then also looking on the day of coordinating different things for that. So we really want to get people involved with the planning as well, because it's an amazing opportunity to meet clinicians, to connect with the people that are working at admissions at all of our tabling medical schools and organizations, to have that kind of build some relationships and rep with them as you're coordinating, and just continue to join our PRW family. So if this is interesting at all to you, let us know. We'll have the links. We have the QR code at the end, but just keep this in the back of your mind. Hey, okay, for the next couple months, you know, things might be a little slower, or this is definitely something I want to get involved with and it sounds amazing. If you ever go on our YouTube channel as well, just to get some more reference, we have so many recap videos and so much stuff. I know y'all love YouTube. Stalk us a little bit on YouTube social media, and you can definitely see exactly what this looks like. So that's our first position. The second position, and the second opportunity, the second program, that's our first program. The second program is our Pipeline Dreams High School experience. So what's cool is, because we engage multiple types of students in the pipeline, I'm going to go over both what the program actually is for any high school students. Do we have any high school students on the call? Can you raise your hand if you're in high school? If not, I'm just going to go right to the teaching assistants and the undergraduate students, because it's really a cool opportunity, especially for students who are looking to display, especially like leadership and community service, to grow their graduate or medical school application. Okay. Okay. So I'm going to go right to the internship. I love it. But a quick overview of what this looks like. And I want y'all to drop in the chat. Like I said, we're very engaging. Drop in the chat. I have this graph up here. If you look on the table, you can see we have white, Black, and Hispanic in this bar chart. And each of these 3 clusters represents a doctor, representation in a doctor, in a nurse, and then a physician assistant. Okay, so what I want y'all to do is, if you put like 1 doctor, 2 nurse, 3 physician's assistant, drop in the chat what you think each graph might represent. If you're confused, I'm gonna, because I kind of explained that confusingly, let me do it again. So you can see this first cluster where it says 1, and there's those 3 bars, the white, red, and black one, or the black one, yes, the gray one. This data set represents one of the following healthcare professions. It represents doctor, nurse, or physician. So drop in the chat which you think is which. Which of these clusters is a doctor, which you might think represents a nurse, and which you think might represent a physician's assistant? Okay, 1 doctor, I see 2 nurse, we got 3 PA. I like that. I like that.
Keep it coming, y'all.
Nice. Okay, 1 PA, 2 doctor, 3 nurse. Interesting. Yeah, okay, we got one that's the same.
We told y'all we're very interactive. We want to hear from y'all.
Okay, in the interest of time, I'm going to keep going. However, oh, we got one more. Okay, so I think, okay, so we're tied. Y'all can see the results. So this first one was a physician. The second one was a physician's assistant. And then the third one was registered nurse. So I say all this to say, it's kind of, oh, I thought it was there. It's kind of a trick question, right? These representation numbers look similar all across the board and are similar all across most healthcare professions. As you can see in this graph, how it's represented, you know, our representation, especially for Black and Brown clinicians and healthcare providers, is really low compared to our national population data. That's what makes a disparity. However, I show this because people talk about this all the time. You know, you hear it all the time, Black and brown doctors representation, all this stuff about it. But I think it's very important to ground our conversation too, and everything that we're doing around what it visually looks like, because we can definitely see why it's important to increase diversity medicine. So I also display this because this is the sort of thing that for our second program we're talking about, Pipeline Dreams High School, these are the sorts of things that we're going to be talking about. This is exactly what you as a TA would be breaking down to students. Really, this is a high school program that's hybrid, that is geared specifically towards Black and brown students. We're going to talk about, as you can tell, we're talking about that experience and why it's important. However, everyone's invited. The more the merrier. And we can't do this without allies across every single racial and ethnic identity. How this
Carissa,
works.
let me chime in really quickly. I have always enjoyed your last slide where it really points out, the one prior to that, it points out disparities. Blacks make up about 12 to 13% of the US population. Yet if you look in the numbers here, that's not reflective in healthcare. And it's not that there aren't Black people and Black learners who are incapable of being great physicians and physician assistants and nurses. It's not that at all. But when there have been years, centuries of oppression and centuries of barriers, we are seeing the stagnant number. This data is from the U.S. Census Bureau. You know, for the past 80 years, we've seen the number of U.S. physicians and surgeons who identify as Black remain unchanged at 5 to 6%. And that is problematic. And that's why we exist, so that we can make that flat line look more like a better slope.
I was just saying, exactly. And y'all can be part of that slope by joining our program. So the program meets for 12 weeks in the spring semester on Tuesday evenings online at 6 p.m. Then there's 3 in-person events. Here's a screenshot of, this was really cool, was Dr. Gina Shira. She was literally, gory warning, she was covered in, she just got out of surgery. I'll just say that. And then she hopped on the call. So it was really cool to meet her. So that being said, you're able to connect and meet with a different clinician online from across the country during that second hour of the program. It's 2 hours, but then the first hour is where you're really exposed and learning about health equity research and how you can get into that. And what are these things we're talking about as we're like joining and entering this field? We believe it's important to understand a lot of different ways to gain the opportunities that you need to further your educational and professional career. So here's just some pictures. Here's the healthcare experience, the hands-on. Here, I won't go too fast. So we have the OR simulator, we have suturing, that's an injections, an ultrasound machine. Here's some pictures of us at medical conferences over the years at different medical schools. And
Carissa, one of the highlights and feedback that we received from Pipeline Dreams, specifically the high school students, is they love the suture practicing. Everybody leaves with the suture kit because you don't want the first time you touch a needle and a needle driver to be your first day of med school. So we are working to put you, a decade in front of your counterparts so that you're exposed to terms like, physiology and terms like health disparity. And then you're hands-on, like that one picture at the top there. That's a high school student practicing suturing. And we're right there. I can't tell who that is, but it's one of our patients are waiting team members and leaders who's showing this young human how to suture. And then you get to leave with a suture kit and practice. And even our college students still, enjoy having that. And then you see students holding a hysteroscopic instrument. I didn't hold a hysteroscope until I was a full-grown doctor. And look, you have young humans just doing this. It's the exposure is off the hook. It is off the chain.
Absolutely. And all of the 12 weeks culminate in a research expo where in small groups every week, you take what you're learning, you're taking what you're interested in, you're taking what you're hearing, and you're putting together a research proposal addressing a health disparity of your choice. So here's some different projects from different students, and these are high school juniors and seniors throughout the years. I think on the top right, here's one of my favorites from Fatabo and Abby. They were talking with students in their group, and they realized that one of their schools, because we have students from all different schools, they had like dermatology products, they had acne products at the nurse's station for free for students if they were struggling with their skin, right? So it made them want to go in and look at disparities in dermatological care and how that impacts high school students in their mental health. So, right, that's such a cool project that they worked on and developed, but their experiences and their interests, they were able to craft a really interesting research project. So as an intern, as an undergrad working with our project or our program, that is something that you would help facilitate for the students. Here's just a visual of really where we get our students from. We have students represented from all across the country in a lot of universities and high schools. And as a teaching assistant, this experience is like a 10-hour week commitment. We have meetings on Mondays and Tuesdays. Those are like the heavy meet days. And then Wednesday through Thursday and Friday, it's more check-ins, reporting, and just making sure your students are good, if they have any questions, what they need. Really, it's cool because you're able to learn more about our initiatives as we engage with our community, and then also display leadership leading a group. So how this works for context, I love this graph. So we have a coordinator that oversees the entire program. Then we have a pre-med college intern underneath each coordinator. And then under them, they facilitate and mentor a group of high school students through this research project. So, a preferred background in pre-med or biology, just for familiarity, especially with reading peer-reviewed articles. That's something that we do a lot in this program, and we break down for high school students, especially with public health or even education too, because we are learning throughout this program. We love if you had experience at a camp, or you have experience tutoring or experience working with students in previous capacity. We seek and love to see people who have already displayed those leadership qualities, but are also excited to work with self-starters or creative thinkers as they want to gain more leadership and want to understand where they can find that. Obviously, as a digital program, we love familiarity. You got to know Google, you got to know Zoom. We're making breakout rooms, texting you during the session, hey, can you make sure the poll's cool? Is so-and-so in the right room, et cetera, et cetera. So that's definitely a huge plus. Okay, here's just another picture. I like just to see, I mean, we already talked through all this, but I really love the screenshot because this was our last day. But you can see Dr. Livingston's on call. I'm at my office, but we have college students literally from across the country that are able to be connected. It's like Louisiana, we have Atlanta, we have Pennsylvania, all represented, Florida. So it's cool that we're able to come together and work with students every single week. Okay. Oh, the last thing is we are also developing a manuscript in terms of evaluating our students now that we have 5 years of data. So this internship opportunity would also come with an opportunity for some qualitative research. Here's a quick example of a study that was published from a surgical pipeline program at Stanford. And you can see through just some survey data, they were able to show pre and post the program, how the students' perceptions of a career in surgery in particular changed or developed. So this is something similar that we're really excited to prep up for this 6th iteration, and then also lean on the data that we've already collected and our alumni as they are now graduating from our first cohort into the real world. They're graduating college now. So if this is definitely something you are interested in, please scan this QR code. This goes directly to the Pipeline Dreams webpage on our website. This is what it looks like. I don't know if you can see it because I can't see you guys. But if you press each of the buttons, it's linked to directly to the application. These are currently open for 2025. You know, high school students, you can send them the link if you're interested for the spring. We're finalizing the dates, but the applications close December. So obviously this is far out, but this is the sort of planning that we like to instill into our students in our pipeline that we mentor. Because as you're looking at your spring semester, no matter what place of schooling you're in, you should definitely be thinking while you have some time this summer about different opportunities that are going to help stack your resume and your CV. Okay, does anybody have any questions? I don't see anything in the chat. We can keep pushing forward. Raise your hand, stop me, scream at the mic. It's all fun. You can sing if you want to stop me. That would actually be a really funny Zoom habit. It would keep everybody on their feet. So speaking of planning for and building your resume, we also are open. Our form is open for the PRW machine right now. So this means you are getting ready to apply next cycle for medical school. You're looking and seeking for some guidance, application review and support, maybe some interview prep, or like, I want to do this. I've gone online and I've watched YouTubes and I'm completely overwhelmed. What do I do? If you scan this intake form, I'll send it in a follow-up email to all of you that logged on. You can enter our PRW machine. So that means you get a one-on-one meeting with Dr. Hamlin, who is like our resident, especially pre-med advisor. She is now an assistant professor at UMass Chan. I could snap it up for her. And she's also on the admissions committee there. So she has everything you need to know, completely understands this process, and can walk people along the way for that. Similarly, if you scan this QR, you also have the opportunity to join our MCAT prep cohort. This is really interesting because throughout the years, we've been able to really refine it into exactly what we see help students actually improve their scores. It's really not a typical class-based program. I want to say it's more of a problem-based program and accountability-based program, meaning you're sitting, you have your schedule, you're doing your problems, you're doing your practice tests, you're doing your practice questions, but the cohort really provides you with accountability partners and a coach to help you in more of a personalized way throughout your studying plan, whether that's a year, whether that's 6 months, whether that's 3 months. Also, there are access to full-length exams, the UWorld, like on the screen, but also I think the biggest thing as well is just we want to get you to your goal score, no matter what that is. And the accountability part of this cohort that we're really launching and emphasizing for 2025, I was going to say 2026, 2025, is really what we've seen has helped students get to that score and be able to test on time, on plan with when they want to. So the next cohort is starting in mid-September, early October. Scan the PRW machine to get all that information when it officially launches. But I definitely wanted to announce that this is happening for 2025.
Carissa, I'm going to pipeline in here. Patients Are Waiting has a really strong relationship with several medical schools, Rowan University in New Jersey, Penn State College of Medicine here in Hershey, Pennsylvania. And we get the skinny on MCAT scores and, you know, do they want a 506 or do they want a 511, grade point averages. So we are not just making this up. We're getting intimate details from the medical schools to say, you know, what will make that whole application, you know, stronger. And so we're giving you advice that we are receiving from medical schools. So we're helping to get y'all where you need to be. And we take that responsibility very seriously.
Yeah, we got all the tea, y'all. Okay, so so to review, we've gone over DIM 8 conference event team. Whether that's a coordinator, you hear, oh, cool, I love doing events and this is completely aligned and I'm pre-med, this will be super cool. Or you're like, hey, I can definitely support and I want a free ticket as well. Let me join the event team. Great, first thing. Second thing, or first two things. Third thing, after that, we have our Pipeline Dreams High School program. Those TAs are really responsible for leading a group of high school students. Love that. MCAT cohort, and PRW machine. That's not quite an internship, but that is more of a program for students to come and engage with. And then now coming back to another internship we're offering is a Black History and Medicine tour coordinator. So we've kind of touched on the Black Doctor Factory. Dr. Livingston mentioned the Black History and Medicine mural, I believe. But what's cool is at our headquarters in Southern Market, if anyone local in Lancaster has been to Southern Market, we're kind of up in the right-hand corner. We have this beautiful mural throughout all 6 of our offices that highlights 20 trailblazing, life-saving Black clinicians and scientists. And we have kind of rolling tours that go on of this space just to connect the community with this history, and then also just continue to expose young students especially to these potential careers and really see themselves up on the wall. I mean, I love coming to the office because, you know, maybe the spreadsheet's really kicking my butt and I'm like, oh, look at Dr. Drew. Okay, let me keep working, right? It's a great motivator and it's really exciting and bright and vibrant to have in the space. So as I mentioned, we have these tours, we hold these tours, and it's really cool to be able to talk about our organization, welcome people who are booking a tour to our space, and then also highlight and show just this Black excellence in medicine. So our tours, like I said, they're rolling. The schedule is flexible. We're really looking for something on the weekends. That would be ideal for like this spring or summer time period. So when people are out about at Southern Market, they can just come and pop up and engage with our organization. So this is flexible. It's an internship, 20 hours or less, especially someone who loves the arts, maybe art therapy if you were in person. Shay, that would be really cool. But definitely keep this in mind. Next, we are also looking for a social media manager for internship for this summer, fall, especially going into the DIM conference. On our side, like if we had some more help with the social media, getting even like a reel of every single station at the DIM conference, every single presenter being able to showcase and really storytell everything that we're able to offer our students is something that's great for us, but also great for students so that they're able to engage and learn more about everything that we do. So in terms of engaging more online visibility of our initiatives, our community events, we have and are always on Instagram. Dr. Hamlin's always posting. We're also on Facebook. Dr. Livingston, you post a lot on Facebook, I see, because which is really great. It engages a lot of people. We get so many likes. And then also just we want like a younger, we really want to intern for this because med TikTok, med IG is people always go there when they want to seek information. And as a community-based organization, especially for marginalized communities, social media has been such a powerful tool to share resources and amplify information. So we really also want to always come to all of these sorts of health communications projects with that lens as well. So this is also kind of flex. It's interesting in terms of schedule. We can work with people on that, but definitely having a set number of deliverables per week, understanding how we can duplicate efforts on a newsletter, on the website, on different social media platforms, starting at TikTok, maybe even being an ambassador, a brand ambassador for PRW as you're on your PRW journey as well, or pre-med journey, I should say. So that's a social media manager position, and that is the last position that we have for the fall. Now, where do I go? How do I find all this information? If you scan this QR, you can find it. I'm going to come out of here so I can see you guys quickly, but show you what the website looks like, where all of the information for these positions are. So if you go to our website, www.patientsarewaiting.com, and you go to the Get Involved tab, you'll see this PERW opportunities bar. Now you can see we have all the positions that we referred to today. If you click on the picture, it will take you to an expanded job description of the opportunity and an invite to apply at this link. So you can duplicate that across all of these and you'll see the same thing. Cool. So super easy URL, PRW opportunities. I'll drop that in the chat. Oh, thanks, Hannah. You're amazing. Just kidding. Okay. I guess that's all I had. I thought I had some more slides, but you know, we ran through them. I definitely want to leave some time. I'm right on time. We have 10 minutes left for some questions if you have any as well. And I also did want to screen share before I open it up to questions, just so y'all can get some familiarity. I'm a super visual person. This is what the Ring Central looks like for our DIM conference where you would register. So you can see the flyer. There's some details and images from the event last year that you can see. And then if you click here, that's where you can register and it'll pop up. Great. Yeah. If my Wi-Fi works. Yeah. Right there. So there's a couple early birds still remaining. And then the other in-person prices are listed below.
Yeah,
Great.
and
So
you can share the link with anyone. If you know friends or family that you can come with, that would be great as well.
yeah, I'll just open the floor to questions. Does anyone have a question?
And no question is a bad question. We're here for y'all. So that's what we'd love to hear from y'all. You heard a ton about our program. Where is the conference located? So here in Lancaster County, I'm currently in Lancaster, Pennsylvania. We have the conference at what used to be PA College of Health Sciences. Now it's St. Joseph's University, Lancaster. It's for those who are familiar with Lancaster, Pennsylvania, it's out by like the Greenfield, Costco's, right off of Route 30. So it's very easy to get to. But yeah, here in Lancaster, Pennsylvania.
Great question. It is
Mhm.
also hybrid, which is cool. We encourage people to come in person, but as I mentioned about technology, we will be streaming all of the sessions. But like Dr. Livingston also said, that's really only the first half of the day. It's really only half of the experience because the second half is just dedicated to all these hands-on stations.
Yeah, and it's good for them to know when we were on our community call at the top of this month, remember there was some folks from Georgia and they were like, we're coming up. So, you know, we have people travel to come to our Diversity in Medicine conference because we are such an intentional organization and our goal is to expose y'all to things that you won't ever see in other programs. So we got Georgia. If Georgia can show up, you know, y'all can. I'm not sure where the furthest person is on this call, but we were pretty excited to hear that there are going to be some folks from Georgia traveling for our Diversity in Medicine conference.
Question. If you decide to help with the Diversity in Medicine Conference event team, is it fine for you to still be one of the volunteers even if you can't be there for the full week? Because I see that you have days, like it's from Wednesday all the way to Sunday. If I can only make it to the actual conference on Saturday, would I still be fine to actually be a part of the team though?
Yes, that is fine. We definitely we put that just because there's so much stuff happening to make things happen that day. But joining the team for internship opportunity to help plan is definitely something that we can talk about in terms of schedule.
Yeah, that's a good question. But yep, there are many ways to help us remotely. Much of what we do is remote. So yeah, COVID keeps.
Good question, Jordan. I'll look out for your submission. Any other questions? I know my presentation was so perfect, so I'm sure nobody had a question. Come on, somebody else has to have one question. I must have forgot something. Okay, y'all just want to toot my own horn. Okay, so I'm gonna drop in the chat again, right next to each other, the Ring Central. So Ring Central is what we put on for DIM, Diversity Medicine. And then this PRW opportunities link is to submit. It's not submitting an application, but it's showing you have interest to apply. And then what we'll do is schedule a call and see which position that you selected out of. You can check as many on the form as you are interested in. Let me screen share so you can see what I'm talking about. So you have all of these. You can fill out a form just like you did to sign up, and you can check as many as you might want. If you're an overachiever, you could check all of them. If you just want social media, you could do that. Add like a quick little reference or somebody who you know that you've worked with before. And then there's one more question, full-time, part-time internship, and then you can just submit that. Okay. If there's no other questions, y'all are free to go 5 minutes early.
Spread the
Thank
word
you.
about our program. Yep. We're glad y'all are here tonight.
Absolutely. Of
See ya.
course. Thanks, Nicholas. It was so good to meet everyone. I feel so comfortable right at home. Good to meet you, Shay. I hope to meet you soon in person with your auntie.
Aw.
Absolutely. I hope you and your daughter were able to gain some context or even see how you could engage with our organization, Fatma. And then Jordan, I know I've been bothering you with my texts, iPhone. I do not know who you are, but we're definitely happy that you were able to join us as well.
You haven't been bothering me. The only thing is that you'll text me and then I won't see until like a couple days later because like work and school, and then I feel bad and I'm like I can't text her back because it's already been like a week later.
Oh my gosh, you could always text me back. It's so funny because I'm like hit or miss when it comes to texting students, but when it comes to texting my friends, I am horrible. I am so bad. I just have Dr. Livingston, Dr. Hamblin, PRW team pinned, so I get all my information.
No,
all
I'm
my
always scared. I'm always like, oh, it's already been a week past. I'm like, I can't text her. It's already been a week later.
No, always text me back. It's never too late.
Okay, I will. Thank you for the meeting, guys.
Take
Of
care,
course.
Jordan.
Hi, guys. I just want to say hi real
Hi.
quick.
I knew it was you.
It's good to see you guys. I was never able to join the Sunday one, so I'm just like, let me just join this one. But it's good to see you
Yeah.
guys.
So good
No, it's
seeing
good
you.
to see you. When do you go back to school?
I go back August 26th.
26.
Oh, wow. Wow.
Yeah.
Oh my gosh,
Yeah,
it is
see.
your next year. I actually have to connect you with a student I met. She's African too, but she's just finishing up her freshman year, just like you.
At UMD?
Yes, you guys should be friends.
Yeah, absolutely. I would love that.
Maybe you know her. I'll send you her number. But I had like an intro meeting with her. She's like interested in medicine, but I think especially too, I know you were shadowing and doing a lot of cool stuff
Yeah.
and kind of, in the DMV. I think y'all would definitely get along.
Yeah, that would be great. That would be great.
What's
Yeah.
new?
Not much. I'm just, excited to be back to school, I guess.
Really? I'm just kidding.
Yeah.
That's good.
From your mouth to God's ears. Come on, tell us what that's all about. What'd you do this summer?
This summer, oh yeah, I was able to work as a scribe, but it didn't last very long because the onboarding process took too long.
Took too long. Yeah.
Yeah,
That's crazy.
yeah. Other than that, I've just been taking summer classes. I took a bio class that was a
Nice.
requirement, so that's going well.
Oh, that's
Which
great.
bio class was it?
It's diversity, ecology and diversity. It's
Okay.
like more about, yeah.
Ooh, that's cool.
Wow.
But definitely make sure to spin the block in terms of scribing, because now you're all set up for next summer.
Yeah, that's true. That's true, definitely. But I'm excited
Absolutely.
about the opportunity here as well. I'll definitely be applying for the
Yay.
Hey, that's fantastic.
Perfect. I know. We're already thinking about it, but I think last year we got I looked at the application just today as I was like getting ready for today. We got 127 applications last year, but we had to turn a lot of people away. So I definitely think having a cool big team that's also done it before and has context is definitely like the best. So that's the best news.
Yeah. Yeah, but I'm not gonna hold you guys any longer. Thank you guys for everything. It's really great to see you because honestly though, everything you do is really great. Like even the fact that you keep in touch and like it really means a lot.
Thanks. Of course.
Yeah.
Of course, it's my pleasure. So I'll see y'all later.
Bye-bye.
Take care.